the Toronto Star. I'm Saba Eitizaz, and this matters. To boost or not to boost? That is the question after Ontario's top doctor expanded eligibility yesterday. Now, everyone 18 years and older can book that second booster or fourth dose of the COVID-19 vaccine. The announcement was welcomed by many in the healthcare field, but also left some Ontarians a little confused. Dr. Kieran Moore said that healthy, currently vaccinated people continue to have significant protection against the worst effects of COVID and can, if they want, wait for a new vaccine in the fall that will better target Omicron variants.
Ontarians, if they have questions, may speak to their healthcare provider about whether getting a second booster dose is right for them.
Today, Star reporter May Warren joins me to discuss the announcement, clear up some of the confusion, and whether getting a fourth shot now is the right decision for you. Hi, May. Welcome back to the podcast.
Hi, thanks for having me.
Okay, so big news yesterday from Ontario's top doctor, and I want to start off with some of the basics because there's lots of questions about whether getting a booster now is the right call or if it's wiser to wait. And you recently looked at the spread of COVID in the province, and I do feel like a growing number of us have lost a real sense of the threat because we aren't wearing masks, we aren't being asked to test as much. So can you paint a picture for us? How bad are things right now?
Yeah, so I think it's fair to say that we are in a new wave here in Ontario. If we look at indicators like the COVID signal in the wastewater and also even hospitalizations, we are seeing them starting to increase. Mm-hmm. This new wave is being driven by this new variant called BA.5. It's kind of another offshoot of the original Omicron. And what's concerning about it is that it's very good at getting around immunity. So it's better at infecting people who've been vaccinated, but also people who've had a previous infection. So that means it can kind of get to more people. And that's what scientists and experts are a little concerned about. And obviously, people are very tired of COVID. They just want to get back to their normal lives. And a lot of the public health restrictions have been dropped, like mask mandates and things like that. But the disease is very much still present in the province for sure.
Mm-hmm. And you mentioned this latest variant. What more do we know about it and in terms of how it's driving this surge? And is there any sense of how damaging this wave could be?
Yeah, so this variant is the dominant one in Ontario, and it's kind of overtaken other offshoots of the original Omicron variant, which itself is a mutated version of the original COVID from 2020. Mm-hmm. And it's mutated enough that it can get around the vaccine and infect people. And also you can be reinfected more often. So that means just that more people are able to get it. But what's good about the vaccines is that they're still giving you good protection against the worst consequences if you do get sick, like ending up in the hospital or dying. So that's great. So the new variant is just causing some concern because it is, increasing infections. And it's also increasing infections in different places around the world, like Europe and the US. Mm-hmm. And, it's the first time that we're seeing a bit of an increase in some of these indicators this summer. So that's kind of, I think, got people taking notice.
Okay, let's come to the government's decision now to expand fourth doses. Is the booster that is now available to all adults the same as the original vaccine? And I'm wondering if this is going to be effective against this latest variant.
Yeah, so a booster or the fourth dose, the second booster, is the same vaccine that was developed against original 2020 COVID. And that means that it is less effective at preventing infection, but it still does a pretty good job at preventing the worst outcomes if you do get sick, which is great. But because the virus has drifted and mutated so much, it's not as good of a fit as it was for, the original virus. Mm-hmm. So it's basically just giving you a little bit of a boost, and there's not that much evidence yet on that. That's still kind of emerging. But the idea is that, especially if you're high risk, it can give you just that little bit of extra protection.
Right. And yesterday, Dr. Moore said that healthy people under 60 can choose to wait until the fall for a vaccine that could better target new variants. So if I'm young and healthy and I've had 3 shots, should I go and get a 4th shot right now? Because it seems like the math has kind of been left to individuals.
Yeah, Dr. Moore struck a very different tone from, previous vaccine rollouts. He wasn't saying everyone needs to get this. His message was very much that if you're a higher risk person, if you're an older person, if you have underlying health conditions, like for example, diabetes, or you smoke, then he really wants to recommend that you get this. But the hope is that there will be a more Omicron targeted vaccine called a bivalent vaccine offered sometime in the fall. And Pfizer and Moderna are both working on that. And ideally, that will be a better fit against Omicron and these new subvariants. The problem is that these variants are kind of outpacing us faster than we can tweak the vaccines. So it's a bit of a transition time right now while we're waiting for this. But ideally, we will have access to a better vaccine in the fall. So Dr. Moore was kind of saying that if you are young and healthy and you don't have any risk factors, you're not in contact with high risk people, like it's reasonable to wait until the fall. And it's kind of your own personal decision, looking at your own risks and your family and making your own informed decision.
So if I do go ahead and book another shot again, I'm young and healthy, will I have to wait 6 months then to get that specific vaccine that might be coming sometime in the fall?
Yeah, I think that's a great question. Dr. Moore has mentioned that and said that it should not delay your accessing the Omicron vaccine if you get a fourth dose now. Typically, they say to wait like 5 or 6 months for the next dose. So if you get it now in July, and he mentioned the Omicron vaccine maybe being available in November or December, that should be enough time. So he wanted people to know that it shouldn't preclude you from getting that next vaccine. And I should say, not all experts really agree. Here, they're kind of watching this evolving evidence. There's not a lot of evidence right now that the fourth shot gives you a lot of protection against, infection, but some experts are saying maybe it's best to be cautious. We don't actually know what's going to happen in the fall. And there are some that I've talked to and that colleagues have talked to that are saying, go for it. So there's a little bit of disagreement there, which I know makes it really confusing for people. But, this is a story of COVID, right? Like the science is always racing to keep up with the virus. And it's important to know that this message could change. If there's new evidence that comes out shortly saying that this is really needed, the message will change. And there is a lot of concern that people who had the last dose in December or January, that immunity is kind of waning. So that's the idea also here, is to get that little bit of a fresh boost.
We'll be right back. And what if I recently had COVID? Should I wait to get the booster?
Yeah, so Dr. Moore recommended at the press conference that you wait 3 months since infection. But as you know, probably we're not doing widespread PCR testing anymore. So a lot of people just had a rapid test at home. So I think that's a recommendation, but they're not going to stop you from doing that because they probably don't even know that you were infected if you just did a rapid test at home.
So what else are you hearing from healthcare professionals about the efficacy of the second booster shots?
So this is one of those times where we are hearing different things from different experts, and there are a lot that are waiting to see more evidence that the fourth dose really offers you, a long-lasting boost, and there isn't really evidence for that right now. But others are saying things are quite uncertain right now. We don't know for sure that the Omicron vaccines will be available in the fall, and they're concerned that immunity from the last dose that you may have had in December or January, the third dose, is really waning now. So there is not total consensus on that. We may see that shortly, and we may see some of the messaging change if we do see more evidence on that. But we are in a bit of a transition phase right now where not everyone agrees.
So if somebody wants it, where can they get the booster? Is the process pretty much the same as last time? Could you go through that?
Yeah, so the process is pretty much the same as with previous vaccines, but maybe some listeners won't recall all those steps because it's been a while. So you can go on the provincial booking portal and book with your health card for a vaccine clinic. You can also get it at pharmacies. Some doctors are offering it in their offices. And if you're confused, there's always Vaccine Hunters, the group of volunteers who help so many Canadians get vaccines. They are still around. They're not actively answering questions as much, but they do have some web resources to help you find a clinic near you and also to calculate the exact number of days since your last dose. If you're maybe confused about how much time has passed, they can help you with that to figure out eligibility.
So people would pretty much sign up the same way that they did last time.
Yeah, it's basically the same process.
Okay. So, May, why do you think the province has decided to expand eligibility? Because until yesterday, it seemed like they were quite intent on restricting eligibility to vulnerable groups only. Just days ago, I believe you were writing about a group of healthcare workers who were actually going to sue the province for withholding fourth boosters. So, what happened? And so quickly.
Yeah, the province has been getting some political pressure, definitely, from healthcare workers. As you mentioned, a group of them were planning a court challenge under the Charter of Rights and Freedoms, saying that it was discriminatory to restrict eligibility. And their argument was very much, for healthcare workers, they're working in the highest risk places and they don't have access to this other vaccine dose. But they also wanted it to be opened up more widely. And I think that, yes, it was pressure, but also a response to this new wave in Ontario. And Dr. Moore did say at the press conference yesterday that this new wave will probably not be as bad as previous ones because we do have the vaccines that are helping keep people out of the hospital, but also we have treatments for COVID as well. So things are different. But at the same time, you want to have a response to the disease levels rising in the community again. And this is, I guess, one tool that they can use is just kind of open it up and let people decide if this is right for them to get the fourth dose.
And I think at this point, only about 60% of adults in this province have even gotten a third dose. Is there a sense that this move will put us in a better position in the fall?
Yeah, so some experts have been saying that it will help at least to keep the vaccine infrastructure, so to speak, working well. A lot of the larger vaccine clinics were scaled down, but to have that kind of up to speed and ready to go for the fall, I think probably would help. Also, the news today is that a vaccine for the youngest Canadians under 5 has been approved by Health Canada. So we can expect the rollout of that at some point. So yeah, if we kind of look at this summer as a dress rehearsal for all of the parts of the vaccination machinery, then we would potentially be in a good position to be able to just pivot to rolling out the Omicron vaccine in the fall, hopefully.
And I'm glad you mentioned the vaccine infrastructure because, access and logistics was a challenge in the early days. Does it look like Ontario has got its accessibility and logistics figured out in this fourth round?
Well, the big difference right now is that scarcity doesn't seem to be an issue. So it's not that they have a very limited supply like they did at the very beginning, and people are kind of fighting over doses and really having to hunt them down. And also, I think it remains to be seen what the uptake of these fourth doses will be. But I think a lot of people are not as interested and they're maybe not getting it or just not even paying attention anymore. So it doesn't have the same kind of urgency that it had at the beginning. But right now, we have seen some people reporting some issues this morning with the booking opening up, but it does seem to be a bit smoother than in the past. So I guess we'll see on that.
May, are we using the right terminology when we talk about vaccination? I wonder if the words we use need to evolve because it seems like the definition of fully vaccinated is constantly changing.
Yes, for sure. So I think the idea of having the 2 vaccines and being done and fully vaccinated is no longer the way that experts are thinking of it. One thing that they do agree on is that the 3 doses are really necessary. So if you haven't gotten that third dose, particularly if you are at a higher risk or older, you need to do that ASAP. And I think that there is a shift in thinking more towards, are you up to date with your vaccines? When was your last dose? And we're kind of seeing that a bit with these fourth doses. And who knows where we'll go in the future. Maybe it will be a case where you're supposed to be getting a dose every 6 months. Maybe it will be a COVID vaccine and a flu vaccine in one. We'll see. We'll see where that goes.
Right. Well, thank you for making things easier for us and explaining this new round of vaccines. Thanks a lot, May, for your time.
You're welcome. Great to be here.
I was talking to Star reporter May Warren. That's it for today. Thanks so much for listening. I'm your host, Saba Eitizaz. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.